Hello, my name is Dr. Prasad Raj Dandekar. I head the Radiation Oncology Department at Sir H.N. Reliance Foundation Hospital. I get a lot of questions from patients coming to me with what sort of technology do you use for radiation treatment, which machine do you have the latest technology, and all of those questions. And I always tell them that yes, of course we do have the latest technology available in India and one of the best in the world. But also I emphasize that it's not just the machine, but it's the doctors, the physicists, and the therapists to actually deliver treatment to you. That is also of paramount importance. I'm very proud to be working with my team, which is excellent and extremely compassionate, and we have a very patient-focused approach towards treatment. One of the technology we are very proud of, and we are the pioneers of that technology in India, is what we call as surface-guided radiotherapy. We started using surface-guided radiotherapy back in 2015 when most people had not even heard of this technology. And it's a beautiful piece of technology which basically helps us to make the cancer treatments more precise, more effective, and less painful for the patient. What it does is there are 3 cameras which are watching the patient from outside the treatment machine, the radiation treatment machine, and they track the patient's body very precisely. Now, if the patient moves even a little bit while during the treatment, the machines will catch it and the treatment will automatically stop. Even when we are positioning the patient, the patient has to be positioned in a particular way to deliver the treatment for every day. That also, the surface-guided technology helps us to make sure that to begin with, we position the patient very accurately. The other important help that surface-guided technology gives us, that conventionally most hospitals across the world, what they do is to ensure that the patient is positioned properly, they put markings on the patient's body which are made with tattoos, permanent tattoos. And typically they are done at multiple places, minimum 3, but sometimes even can be 6 to 8. And these are permanent tattoos on patient's body which are going to remind them throughout their life about their cancer and radiotherapy. With SGRT or surface-guided radiotherapy, we are able to completely get rid of this barbaric practice of tattooing our patients and making it, of course, safer, because when you are tattooing, my staff is also at a higher risk of needle stick injury. The patient is also at higher risk. So removing tattooing is fantastic. And what the SGRT does is, instead of having those 6 or 8 marks on the patient's body, SGRT virtually gives us around 30,000 points on patient's body. And we are able to track all those points to monitor patient's movement. So if the patient is lying down like this, and even if they move a little bit, a very gentle move, we are able to immediately catch it and stop the treatment. So we are very proud to be India's first hospital with surface-guided radiotherapy on our first linear accelerator, which was TrueBeam. And we are again very proud to be India's first surface-guided radiotherapy on our ETHOS machine. And here on ETHOS, we have another addition, what we call as a ring applicator of the surface-guided radiotherapy, India's first and one of the first in the world. So at Sir H.N. Reliance Foundation Hospital, we are absolutely committed to being at the cutting edge of the technology, not just because we want to boast about it, but because we care for our patients. We want to deliver the best care possible for our patients.